Joining me now is Chen. He's an associate professor of health policy and economics at the Yale School of Public Health, and someone I know who used to live in China, who's younger than me, and is planning to get back, has been in contact with his friends in China, and one was joking, if you don't have COVID, it means you don't have a social life. Apparently, his group of friends in China ending up seeing a lot of cases of COVID. I want to get your sense of what we're seeing there. Where do things stand right now in terms of cases?
Yeah, since China have been lifting the mass testing mechanism, so the new infected cases may not be very reliable. So researchers like me have been trying to use the web search index. Search like fever, cough, and those as a keyword, which usually match the infections curve better than the number of cases reported by the health officials.
Yeah. So what's your sense looking at that?
Yeah, so in the last couple of days, we see many cities have very fast surge in the cases. People may have mild symptoms, may not even asymptomatic, so they may not need to go to the hospital, and so they only receive the antigen test. But the travel may be dangerous for many people who are vulnerable, especially who live in central China, western China, especially in rural areas. We know that their healthcare system is more understaffed. So during the winter travel, which is coming, I would very much encouraging people to get vaccinated, especially the third dose, where have a much higher efficacy. Because when people travel, they spend more time indoor due to the lower temperature, and also it's a flu season, so the symptoms for flu sometimes can be overlapping with the COVID, so it may put extra pressure to the healthcare system. So get vaccinated in the next 2 weeks, which is the golden time period, because we still need around 10 days to build the immunity after vaccination.
Yeah, as you point out, winter's often a time when we see spikes, and I imagine you would expect some type of surge this winter. So when you talk about encouraging people to get vaccinations, we're still seeing this gap, especially with the elderly, where they're just not getting the vaccinations. What more can be done to kind of urge them, kind of prompt them, push them, in a sense, to do it? Because obviously they're the more vulnerable target group.
Yeah, this is very important question. So I think first of all, communicating with the public to let them know that the third dose is really important. Especially a majority of older adults already received their last dose of vaccine almost 11 months or 1 year ago, and the efficacy may decline fast after that, almost 1 year. So it's very important to have a booster dose. And also, I think from the incentive point of view, could give more incentive for people to get vaccinated. For example, to allow them to go to more spaces if they still do not have that capacity to do so. And also, I would say that have health education about mitigate the vaccine hesitancy would be important. And also from the health authority perspective, China may want to build a system that people can report their adverse events after receiving the vaccines to a system. In America, individuals and hospitals and other health facilities can all report adverse events. But in China, this is the task or responsibility for the hospitals. But if we put more responsibility and capacity to individuals, this may gather better data to facilitate the communication with the public.
Chen, always a pleasure talking to you. Thanks so much for your insights.